Hello again, everyone. My name is Marty Guthmiller, and I'm CEO at Orange City Area Health System. Welcome to the 23rd edition of our COVID-19 community briefing. I'm going to start off with some numbers today and maybe a couple extra things. So we'll start off with our local scoreboard. 224 tests conducted here at Orange City Area Health System. 19 of those tests positive. We remain at 8.5% positive rate. We do have 15 tests pending. Those are not high concern pendings, as most of those are pre-surgical. We screen all of our same-day surgeries, and so a lot of those we're doing for extra precautionary reasons. Again, before I get into the numbers, I just want to remind you of a couple websites that are of interest. Coronavirus.iowa.gov is a very good site. It has lots of information. I discovered some new information today, and I'll share with you in just a moment. And testiowa.com. Testiowa.com is the place to go to register if you would like to have a test done. Right now, that's being performed in Sioux Center is one of those sites. And if you'd like to go over and have that done, go to the website, testiowa.com, and they'll walk you through that. From a county perspective, we do have 214 positives out of 997 tested. So that remains above 21% at 21.5%. And so that number is high. We think that as Test Iowa numbers get out, there's going to be a lot of folks who are tested that just kind of want to know, and we expect the majority of those to be positive. And so hopefully our positive rate in the county will go down. Another thing that I've been sharing with you is hospitalizations throughout the region, and that's important to kind of understand not only the trends, but the severity of what's going on. In Iowa, there are currently 336 hospitalizations. That's an important number, but probably more important for us, quite frankly, is what's in our area. Sioux County currently has 1 hospitalized patient, O'Brien County, 0, Lyon County, 0, and Plymouth County remains at 5. A couple other counties of interest. Woodbury County is 46. That number has dropped below 50 for the first time in quite a while. Polk County is 95. Again, remains beneath 100, which it's been above for quite a while. And more recently of interest is BV County. Buena Vista County in the Storm Lake area is up to 14 hospitalizations at this point. And I believe the state has announced an outbreak now with 555 positives out of the plant there in Storm Lake. And so again, only 14 hospitalizations though. So most of those positives are apparently relatively minor. Region 3, stepping back then to Northwest Iowa region and the 20 counties in that region, we have 98 people hospitalized in those 20 counties. That number is down from 106 the last time we talked, so that's a positive trend. We had 7 hospitalizations in the last 24 hours, so that's just a short-term glimpse there. That number previously was 6. So both of those are relatively positive numbers in terms of stabilizing or actually decreasing. The ICU rate, though, continues to go up a little bit. We're at 45. Of those 98 hospitalized, 45 are in the ICU, and that number was 43 previously when we talked. And if I remember correctly, that number was up from the upper 30s the time we had talked before that. So plenty of availability of beds and ventilators in Region 3. That really is not the primary concern. The surge is not expected. The social distancing measures have flattened the curve to eliminate really that concern of both PPE and availability. So we're not out of this by any means, but we are better prepared for what currently happens. And really, that was the purpose of social distancing to begin with. Not that we would not get sick, but that we would spread that out longer so that we were within the capacity of healthcare systems to deal with that. Stepping up now from Region 3, we do have the state of Iowa. And we in Iowa have tested 1 out of 22 people at this point. That represents to 18,792 positives. And the 1 out of 22 represents a 12.8% positive rate. So again, Orange City Area Health System tests are 8.5%. The county is at 21.5%, and the state is at 12.8%. It's been really interesting to watch these numbers as we've been going on. Our rate in Orange City continues to be at 8 to 9%, as it has been pretty much consistently from the very beginning. Something new that's out there, and it's very new, and I've talked about this a lot, and I think it is really our future. And if I had the option of having a test today, it would be what we call the serology test, or the test for antibodies, or continuing in layman's terms, it determines whether or not you have had the COVID-19 virus, not whether you have the COVID-19 virus. That's obviously important. I have a number of acquaintances, and I've heard a number of stories about, I think I had it. I think I had it back in February, that kind of thing. Well, this serology test will be able to show that you've built up antibodies, and the thought is that you would then be immune to either spreading the disease or contracting it again. These numbers across Iowa are pretty low in terms of the number of tests, but again, it's on the coronavirus.iowa.gov site. Go to serology tests, and you can look this up for yourself. In Iowa, we've done only 17,280 of these tests. 1,834 of those tests are positive, meaning that there are antibodies present. That's an 11% rate. So a fairly low rate in terms of positive antibodies. So again, you don't know the environment that these were tested in, if people thought they had it or whatever, but 11% positive. In Sioux County, very few of these tests, 104 have been done to date, and 3 have been positive. So that's a 3% rate. So look for that number over time to go up, particularly this fall, when we look at things coming back to school. I'm thinking of colleges and high schools, elementary schools, all of that, people coming back into groups where it's important to be able to test antibodies, test resistance, test immunity. This of course, is a very important thing in our senior care homes as well. If we happen to have residents who are positive for the antibody, or if we have staff that are positive for the antibody, we could have potentially some kind of relaxation, at least for those people, of some of these measures. I want to touch briefly on a very touchy subject right now, and that is masking. My understanding is that the World Health Organization has come out with, just today, a recommendation that people not mask unless they're caring for somebody who is ill. So an asymptomatic patient, or I'm sorry, an asymptomatic person, in other words, somebody that doesn't exhibit any symptoms, should actually not wear a mask unless they're caring for someone who does have COVID-19 symptoms or is otherwise ill. That's very controversial. That is in conflict with current CDC recommendations and IDPH recommendations in public health, which basically say and are advising people to wear masks in all public settings. So what's our advice? At this point, our advice is to use common sense. The hit on masks is that it provides a false sense of security. It also provides an opportunity to fiddle with it, mess with your face, touch your face, do those kinds of things. So in some regards, in some studies, in some opinions, wearing a mask can actually cause more harm than good. You can find a study to really fit your narrative at this point, either for or against wearing a mask. I wanted to mention this, though, with the WHO coming out today and in conflict with the CDC. Our advice is to use common sense, follow the CDC and public health requirements, which is if wear a mask when in public, unless you can assure yourself of the proper social distancing measures. You know, that's still, you know, they're still talking about, is 6 feet enough? Should it really be 8? You know, the thing is, nobody knows. Nobody really knows. So keep that distance. Use your common sense. If you're ill, certainly stay away from folks. Wear a mask, and let us know if we can help. So I wanted to bring that up. Again, I don't have an answer. Quite frankly, nobody has an answer. And so again, my position is continue to follow CDC guidelines, IDPH, and use common sense in all regards. I was going to say today, and I forgot about this, I was going to start by saying I'm pumped today. Why? Not because it's Friday, not because the sun is shining. Both individually would be enough. But actually, I think today I'm on my 5th consecutive day of exceeding the calorie count in terms of burning calories, not intaking calories, that my Apple Watch has for me. And so I've exceeded that 5 days in a row. And I use that as a lead-in to control what you can control. Keep tuning up the engine. Reduce those comorbidities that, you know, lose some weight, keep your high blood pressure down, manage your blood sugars, those kinds of things. Quite honestly, and in full disclosure, my upcoming elk hunt in November also has something to do with that. But the fact of the matter is, get out there, get outside, walk, exercise. You'll feel better just because of those things alone, let alone what it does for you in terms of building strength, building immunity, those kinds of things. So please take care of yourself. We are here. We ask you to come back and let us continue to do all those maintenance things that we should do. We don't want those things going undetected, and we are here for you. Thank you again for that privilege. We want you to stay strong, stay vigilant, and stay healthy. Thank you again for joining us, and have a great weekend.